Okay, everyone. So I hope everyone can hear me. It's right at 12, so we're going to get it started because I want to be mindful of everybody's time. Thank you for joining us today. The Chamber is hosting this call to really provide you all with as much information as possible, what's going on regionally and in the city of Danville and Pittsylvania County. So we are going to go on and get started. We're going to hear from 4 speakers today. And there'll be time at the end for you all to ask questions, but we have the chat box open on the right-hand side of your screen. So as our speakers are talking, if you have a question, feel free to go on and type it in that chat box, and I will ask those questions at the end of the call. So we are going to go on and get started. In case anyone didn't hear, we are recording this, so we will send it out to everyone who registered for the call, this recording, so that you all can access it in the future. So we're going to go on and get started with Dr. Scott Spillmann. He's the District Health Director for the Virginia Department of Health. And each of our speakers are just going to give a quick overview, especially how COVID-19 is affecting our region and rural communities. So Dr. Spillmann, I'm just going to let you go on and take it away. Are you there and able to hear us well?
I can hear you, and I think now you can hear me. I had not used the Zoom before, so my apologies. I was new.
That's okay. We're all learning right now. We're all being flexible.
I can hear you, Rachel, as well.
Okay, great. All right, Dr. Spillmann, I think you're all good to go.
Good. Okay. I apologize for the sultry sound of my voice. My allergies are kicking up, and I assure you, I do not have COVID-19. No one will get that on this webinar today from me. The health department, of course, is we are part of the Virginia Department of Health, and we're working closely with our government community partners, our other healthcare community partners, and especially with the local hospitals to address.
Rachel, can you? He's a little muffled or muted. Can you?
Dr. Spillmann, are you using computer audio or your phone?
I'm using computer audio.
Okay, could you just speak up a little bit louder for us?
Okay. My voice won't let me speak too much louder. Let me see if I can move this up just a little. Does that help any?
It's helpful when you get closest to the microphone, Scott. Maybe try to get closer to your microphone.
I'll have to put my face in it. Sorry. I am close. I'll try to speak a little louder. Thank you, Mr. Larson. Okay. Well, the Virginia Department of Health. Can you hear me now? Is that okay? Is that better?
It's very poor quality.
Okay. I'm not sure what I can do about that at this point.
Dr. Spillmann, I can send you a phone number to call in,
okay.
And that might be better quality. So Alan, why don't we jump to you while we get Dr. Spillmann set up with a new line, if that's okay?
Sure. How about my voice? Can you hear me okay, Rachel?
Yes.
Others?
Yes.
Okay. Well, first of all, thank you for the opportunity to share. These are definitely crazy times. No one really could expect or truly be prepared for this, but I think I appreciate the opportunity to be able to share with our community leaders and community businesses some things that your community hospital is doing. And preparedness is a unique thing. I think that's what healthcare does best. We work well in crisis. And so a lot of work has gone into our planning and preparation over the last several weeks. All of our preparation is in conjunction with the work that Dr. Spillmann and the health department and the CDC is guiding us. And so I think that what you need to know as a community is that we're ready. We're doing everything we can to be able to meet the needs of these patients as they are identified, and that we're able to minimize the risk of exposure of this disease, both to our employees as well as to the community. So a couple of things that we've done here at the hospital to achieve that goal. Number one, not very popular, but we have implemented more strict visitation policy or restrictions for visitors. At this point, we have had to go to zero visitor protocol for both of our hospitals in Danville and Martinsville. There are a couple of exceptions. exceptions for families that are experiencing end of life or beginning of life, and pediatric patients. Those are defined by each individual physician in each individual case. So unless you have been approved for visitation by a patient's physician, at this point we're asking for no visitors to come to the hospital. All entrances to the hospital have been closed except for two, the emergency department and the main entrance. And each of those entrances to the hospital are met with employees who will go through a series of questions to ask of your appropriateness. Even if you've been approved to visit, if you have symptoms and have gone through a screening process and identified as a potential risk, then we're minimizing those visits as well. We're doing these things to help, again, to keep ourselves and you and the community safe and reducing the risk of spread of this disease needlessly. We've also rescheduled all of our elective procedures, surgical procedures, radiological procedures, other procedures, so that helps us conserve our equipment for protection, their face shields and gowns and masks and gloves. So that's the reason for rescheduling those. If there are urgent cases, of course, we're still doing those. The emergency department is still open for taking care of emergencies. And we are able to do that. And you need to know that the hospital is safe when you come for emergency care, that we've eliminated or minimized, I don't know that anybody can say they've eliminated, we've minimized the risk of the spread of the COVID-19 virus to other people who are not suspect to those patients. So it is safe to come to the hospital. We have well-trained and prepared staff to be able to assess and identify the risks of patients who need to come. We also have, SOVAH Health has several physicians and clinics in the community. The same protocols and processes are in place for them as well, that anybody that is scheduled to see a physician, they're going through screenings before being seen and asked not to come if they have any conditions that would cause them to be suspect of being a carrier of the COVID-19 virus. So let me stop there, Rachel, and let others share, but that's what we're doing to be prepared.
Okay, thank you, Alan. That's great. Dr. Spillmann, were you able to call in?
I'm sorry, I did not receive that update from you yet. Is that something?
Do you
Was
see
that on
it?
that other note?
Do you see a chat box in your right-hand corner of your screen?
Upper or lower? I see a chat box, yes.
Yes, so there's a 646 number right there.
Okay, all right.
And you should be able to call in with that.
All right, I'll do that right now.
Okay, wonderful. We're going to go in and jump to Ken Larking with the City of Danville, if that's okay, Dr. Spillmann, while you're calling in. So Ken, if you wouldn't mind giving us an update on what's going on with the City of Danville, that would be wonderful.
Sure. Can you hear me and see me?
Yes, everything looks good.
Okay, great. We have been working on this issue for several weeks now. When it first became apparent that there might be an issue, it was important for us as a local government to make sure that we were prepared. So I had some early conversations with David Smitherman, who will be speaking here shortly, about what we can do together to be ready and respond. We coordinated a meeting with Dr. Spillmann, which occurred, I think it was a couple of weeks ago, with our emergency response team locally at our fire department. David participated in that, and we got an update on the current status of what was happening out there. And this was really before any of the, anyone was really taking it very seriously. I think some were, but now I think everyone's taking it very seriously. So we talked through that process. We heard from Dr. Spillmann about his assessment of what needs to be done. The city has put out information on our website, which I would encourage people to go to. It's danvilleva.gov/coronavirus. It's got all the information that we've done. It has links to other sites that, like the CDC and the Virginia Department of Health and others that are verified and dynamic, so they're constantly being updated. We also have a website which is nearly complete, but still it is live right now, and it is in partnership with Pittsylvania County as well. It's our discoverdanville.com site. We have discoverdanville.com/COVID-19, which is COVID-19-response. Anybody wants to go there, there are links to resources for businesses and others. So really my approach from the city has been, how do we educate the public on what they can be doing to prevent the spread of the virus? Of course, that's working very closely through the guidance of the health department and what they put out. I've been very concerned about our city employees, our workforce. We want to make sure that we have the ability to continue delivering services. Much of what we do at the local government level is considered an essential service. We have utilities, police, fire, public works, sanitation, all array of services that are necessary for a government, for a city to function. So we're making sure that that's happening. The other focus, of course, has been how do we support our small businesses? And so we've taken some steps that many of you have heard about regarding small businesses, including, of course, the start of this website. But we've deferred some local taxes for hotels and restaurants who are particularly impacted by this particular issue. We've eliminated the disconnection of service for utilities for all customers, regardless of customer class. So that includes businesses, of course. Eventually, those payments would have to be made, but we're not disconnecting for non-payment. We're also not charging the $50 late fee, which is on an account that is behind. So those are some of the things we've done. Looking at my list here to make sure anytime we get information from the state or federal government regarding programs, we try to push that out through press releases. So we've been trying to use all our media to make sure we get the word out through our means, River City TV, our website, our public information office. We hope that the local media picks that stuff up as much as possible. So we're trying to be as transparent as possible about our response and trying to meet the needs of our businesses. And we're open to creative and innovative ideas. For example, actually our public works department decided on their own, without really, I don't think, any input from anybody, to block on-street parking downtown for restaurants who wanted to offer curbside pickup. And that's just one example of things that we're doing to help our local business.
Great, Ken, thank you so much.
Sure.
If anyone is having questions as we go along, please just put them in the chat and we'll make sure to get all those questions answered at the end of the call. David, are you on?
I sure am.
Awesome. Do you want to go on and give us an update? And then we'll come back to Dr. Spillmann once we get him ready to go.
Sure. We're focusing on the things that we can control right now. We have a small staff, and our emergency services are largely staffed by volunteers. We are very concerned right now to get the right personal protective equipment in the hands of the right people. We've had a very difficult time, as everyone, getting their hands on masks, body suits or Tyvek suits, other personal protective gear, but we're working hard to get those in the hands of the folks that need it, like our sheriff's deputies. We are closed at county government except by appointment only. We are very cognizant that the construction community is still working, and we are still facilitating the construction industry through permitting and inspections by appointment. We have a very large pet center that on an average day could have 350 animals in it. We're working very hard and have had great response in the community to get animals fostered. We're down to a little under 100 animals right now and trying to get those out. We have a lot of employees that have essential roles during this emergency, and we are doing our best to limit their contact with the public. So there's a lot of drive-up services, such as at the pet center, we are opening a food pantry for those that are unable to afford food, and are doing that as a pre-order and drive-by service. We're working with our local industries to identify those that are in critical supply chains to make sure that they are able to work and have the resources they need to supply the emergency industries, whether it be medical supplies, whether it be logistics, or other areas that our industries are working right now, and are working with the Secretary of Commerce and Trade's office and VEDP to ensure they're aware of those critical industries in our county. We have continued to run our solid waste operations at regular intervals. In fact, we're seeing that so many people are going home and taking advantage of the great weather that our solid waste system is actually being inundated with more trash than it's seen in a long time. So we're having to increase our frequency of work in our sanitation areas. We have announced and made available quite a few Wi-Fi hotspots. We are particularly concerned about our young folks, whether they be returning from college or be in our public school system. All 4 high schools are public Wi-Fi spots, as are about a dozen spots that have cameras at our solid waste convenience centers. Our downtown buildings in Chatham, you can park on the street and catch Wi-Fi, and also making people aware that Comcast has unlocked its Xfinity internet service for everyone's use. And like the city, we are not charging, or we are not disconnecting water and sewer services for our utility customers during this time. Those are some of the things we're doing to keep operations open. We're leaving the medical community and public health community to advise us on those health concerns, and we're going to do our best that we can to provide essential public services through our local government.
Wonderful. Thank you, David, for that update. Again, if we have any questions, please put them in the chat box so that we can ask them and get them answered at the end. Dr. Spillmann, did you have any luck calling in?
No, I've called in about 4 times on both my cell phone and my landline, and it said the meeting was closed and hung up on me. Can you all hear me if I stand like right here? I'm trying to. Thank goodness you can't see me because I wouldn't have the 6 feet distance. Can I try to go ahead and talk like this? I apologize. I know the quality is not great. Sound quality is not great.
Yeah, just get as close to your speaker as you can, and just speak up, and we'll make do with what we have.
Okay. Excuse me. Thank you, and thank you for the opportunity. I echo what all of my colleagues online have said, and thank Mr. Larson and the hospital for partnering so well with us. Also want to thank Mr. Larking for the opportunity to work with his group. Those are great partners. The health department is in a unique position right now than we normally find ourselves, and with this we've had to make adjustments, and a lot of our work is. Can you hear me okay? Can you hear me? Okay.
Yes. You're fading in and out a little bit, but
okay.
It's okay.
I'm trying to stay right there. In part of our adjustments, just as our normal operations, what we're doing is we've had to reduce our clinics for that the nurses typically and nurse practitioners function in to just simply those only essential, and rescheduled everyone else, and we're trying to handle as much as we can that way by phone. And I'm talking about the WIC, the immunizations, the other types of clinics that we have. our environmental health folks are doing their best in terms of going out and handling our on-site services, which is soil and you know, the well and septic, and the as well the restaurants. And of course, it's a little bit different situation right now with the restaurants. And I do want to encourage everyone to support all our local establishments. They do a great job. And I had a great experience with them last night. And they just were, their customer service was way up there, more than I almost ever had anywhere else. It's still, you know, rabies and things like that don't go away. So we're still handling those best we can. In addition, our epidemiologists and our emergency coordinator are working overtime. Now we are shifting our clinical people, our nurses, our public health nurses are handling a lot of the incoming calls for general population. If there are more complicated calls, they'll go up to our nurse practitioners. We're working right at the elbow with our epidemiologists, and then of course at that point with the most complicated or the ones that are more urgent, like with the hospitals and other type facilities like that, epidemiologists handle directly. We're shifting all these people to doing a lot of contact investigations. And just from one case alone in this area, we have just under 300 contacts that we're working through, and that has to be done one at a time. So very labor intensive. Our hours are the same, except that you know, to the general public. Before and after hours, we have a lot of phone calls. The other phone calls that come in, the typical phone calls are 8 to 5, but the ones from the hospital and other health facilities like that, we handle pretty much any time, day or night. We're also, many of those have to do with, does this or that issue qualify for the testing, and there has been some expansion of those, and so we're working with our hospitals. We're also trying to do as much as we can by phone with our WIC program, and so to minimize the need for the ladies and their children to come out, and we have special authority to do a lot more by phone than we had been before. Of course, hopefully that might have been established as new normal for us for contacts and assistance. I'm there for other questions. I don't know what else you might need to know.
Okay, thank you for that. And we'll try to get a better recording of Dr. Spillman's information as well to try to send that out to everybody. But we can go on and open it up for questions if you all want. So please just put your questions in the chat box. We have a couple coming through right now. Somebody wants to know where the list of hotspots can be found other than the Xfinity page.
Sure. We have on our website a list of all those hotspots. Generally, they are inside the town of Chatham, in front of county administration, in front of the community center, on the main street in Chatham, near the sheriff's office. They can be picked up, as well as select sites of our convenience centers, but those can be found at our website, and we will be adding to that list as we find more opportunities to broadcast. Probably the best signals are going to be at the 4 high schools. You'll have to park in front of the high school, but there are external antennas projecting outward from the front doors.
The city of Danville also provides some hot spots, and that's really at any time, and not just for this, but at the Carrington Pavilion, at the Welcome Center, at Ballou Park, and at Anglers Park, and then also on Main Street. So people are able to connect to our in Danville network in those locations.
Great, thank you. And we will send out the link to both the city's and the county's website for everyone to have access to. And we'll also send the link to the Resource Center on the Chamber's website so that all of you have the links to all of those resources. Alan, this is a question for you. what are the visitor expectations for the hospital? Is it still safe to come to the hospital? People are just wondering what those protocols look like.
Two parts to that question. Is it safe to still come to the hospital? Yes, absolutely. You need to. In fact, I just got a text while we were on this call that somebody was sending a son with a head laceration to the hospital. So yes, we can still take care of well patients. Got a text from somebody else, was concerned that my comment as I was concluding my earlier remarks is that if you have symptoms that you should not go to a physician's clinic. Let me clarify that. If you do have symptoms and again, Dr. Spillmann and both the hospitals, both the city and the county have great spots on their website. The hospital does too, for symptoms. So the CDC has been very clear on what those symptoms look like. If you have those symptoms, you're going to be asked when you come to the hospital or to a clinic to go through those symptoms. You should definitely still come. But if you do have those symptoms, we're going to treat you with special care and concern to avoid sharing that potential contamination with others. For visitors, at this point, unless you fit into 3 categories, you'll not be allowed to visit people in the hospital. The one category is if you have a loved one or family member who is nearing end of life, then there will be opportunities for families to gather to send off loved ones with love and with peace. Or if there are babies that are being born, they're allowing for one support person to be there with that delivery. And then for pediatrics, parents or guardians are allowed to be present for those pediatrics. So restrictions are there, but that can be adjusted. Yes, the hospital is safe for you to receive care, both for suspicion of COVID-19, as well as for any other accident that might happen because kids are spending too much time at home and creating problems.
Great, thank you. Just a quick update from the Danville Museum. They have some Virginia Humanities grants, and they've paid for videographers and technical specialists. So they have content that could be virtually projected on empty buildings or in parking lots. They'd love to hear from specifically the public schools to see how they could partner on programs regarding their collections and other programs from the Virginia Association of Museums, and really engaging families during this time through the internet and seeing what they could do to become more connected. So if anyone is interested in that, please contact the Danville Museum. Can anyone of our speakers speak on the second case of coronavirus in the area, and then what reminders do we need to have for the public to be aware of?
I think Dr. Spillmann could cover that one.
Yes, well, we're not able to talk about the specifics of the person, or that person's privacy, but the person is at this point doing reasonably well. I want to knowing much about the case really doesn't solve what we really need to do to take care of each other and to take care of our, to minimize the spread. So what we're still advising is stay home when you're sick, avoid contact with sick people, cover your mouth and nose with a tissue or your sleeve, not your mouth if possible, coughing or sneezing. If you happen to have to sneeze or cough into your hand, washing it right away or use the alcohol-based hand gel sanitizer. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently, touching objects and surfaces. If you have symptoms, of course, call your local provider and practice social distancing. The social distancing is actually one of the most effective strategies, aside from washing your hands, that we have for minimizing the ability to spread, avoid crowds, and again, stay away from those who are sick. I know people are very curious about anyone that has a health issue, But again, it's whatever's in there, what we did in our press release, that's what we have to stick with for the person's privacy.
Okay. Aside from the social distancing, proper hygiene, all of that, is there anything else community members can do to help during this time?
Maybe I can answer that question, Rachel. Many people have asked, can they help provide supplies? We've received the personal protective equipment, masks, gloves from a lot of communities that departments or areas that are no longer needing them. So if you do have masks or gloves or gowns or face shields, we would be very grateful to receive them. The community needs to know that we're prepared and we have enough. We don't know the duration of this disease, this virus, and so it's unsure whether we have enough for how long. So there are a lot of churches and other groups that have offered to make masks, and there's a lot of homegrown ideas for making masks. So we're working on getting the best pattern for appropriate masks that we will work to share, that folks can help us. If you do have already commercial grade masks or gloves or anything like that, please contact the hospital. Ask for Cheryl Brumfield here at the hospital, and we would be glad to receive your donations of any of that personal equipment that we could help keep our community and our healthcare providers safe. Maybe just a comment about should you wear a mask. If you think you're suspect, or if you're worried about being contaminated, should you wear a mask? The CDC's been pretty clear on that. A mask really doesn't protect you from being a suspect for receiving the virus or being infected. As Dr. Spillmann said, the best way to prevent yourself from getting COVID-19 isn't wearing a mask, but social distancing, washing your hands, don't touching your mouth and your eyes and your face. If a patient does have suspicion of having COVID-19, we are giving them masks and asking them to go home and to quarantine. They are the ones who are suspicious of spreading that virus around. But you're not more protected by wearing a mask yourself. You're more protected by washing your hands and not touching your face.
Great, thank you all. Another question coming in, with those that do work in essential services and are still operating, hospital staffs, manufacturing plants, government employees, police, fire, rescue, do you all anticipate any services would be disrupted for those businesses due to increased demand on wastewater, solid waste, or other areas where there could be changes or disruptions to services or asks to lower their demands?
I can jump in. I don't anticipate any disruptions in services at all with regard to the city providing any essential services. Are you hearing me?
Yes, you're good.
Yes.
We have a continuation of operations plan in place. We're working, we've implemented social distancing throughout our workforce. We are being very careful in the way we handle how we go about our work. We are, like I said earlier, a provider of utilities, water, wastewater, sanitation, all the things, fire, police, all the things that people expect to have on a daily basis. We have no doubt that we'll be able to continue doing that, and we don't think that any of that is a burden on our ability to continue doing that.
So we remain concerned about our volunteer support in our EMS system. We certainly rely heavily on 12 volunteer rescue squads, and we're very concerned about their health. We caution everyone and encourage everyone to use those services judiciously when needed. We don't need responders being brought into compromised situations unless it is absolutely necessary, as we don't see any reduction or any change in our essential services of any kind.
And I'd just like to add to that, a few weeks ago when this was emerging, I had a conversation with our fire chief. As many may know, when you call 911 in the city of Danville, a fire truck will often show up, if not before, about the same time as an EMS truck. And so our firefighters are trained to do some level of service for a medical patient. So we made sure that they understood, all the firefighters understood that they needed to wear their N95 masks and gloves and eye protection. And I guess one step before that is our 911 center. When you call 911, there's a typical set of questions that they go through depending on what the emergency is. And what was included a few weeks ago was some questions that would help indicate whether or not the person requesting service is likely to have COVID-19. So that actually put our first responders on alert to make sure that they're practicing safe handling and also using their PPE properly. That's their personal protective equipment. So we've been trying to be proactive in all that. Our fire department responded to the first patient that was announced here in Danville. And so when they were on the call, they took all the precautions they needed to take. And we've been advised by the CDC and others that our employees were at low risk. They're just self-monitoring at this time, but they're at low risk of having any infection because of the steps we put in place to help protect our employees.
And I'll add on to that, Ken, that's very appropriate. Because of that advance notice, then the EMS fire were able to alert the hospital that this was a patient of suspect, so that we were prepared when that patient came in to reduce the risk. So we're doing all that we can. All of our patients who are currently of suspicion, we call them persons under investigation, until the testing comes back to confirm positive or negative. All are assumed positive, and we've cohorted all those patients on one area of the hospital and making sure that those employees are minimizing their risk by being supplied and prepared to take care of those patients. So it is working well. The collaboration is great to see. This community has come together. Many of the healthcare providers in the community are reaching out and working out with each other. Others are being added as we go forward, so that the preparation, the education that David and Ken spoke about can be shared and best practices gained across. And at the heart of all of that, though his sound quality is suspect, his knowledge and education, Dr. Spillmann is doing a great job of leading our community and our physician providers, and making sure we're all aligned together in our avoiding of spreading this disease in our community further than it needs to be.
Okay, great. Can you all talk a little bit about testing locally and what that looks like, please?
Let me take that one first, and then maybe Scott, if you can add. The CDC recommends that if you have suspicion for being a person of interest, then you should contact your primary care physician. Across the country, and especially and here in Danville and Pittsylvania County, the access to a COVID-19 test is through a provider. So all of the providers in the community do not have access to the test equipment or protective equipment. So we are consolidating our testing into a few locations. So if you have suspicion, if you meet the criteria that has been identified by the CDC and the Virginia Department of Health, the place to receive testing is to go through your primary care physician. They will communicate with you over the phone on what you need to do next in order to be tested. We do have test kits available. They are being provided to those who are identified by the professionals as being in risk and meeting the suspicion. But we don't have enough as a nation or as our region to test everybody at this point.
Okay. Another question that came through, Alan, does SOVAH need any blood donations, and what does that procedure look like?
Yes, please. We do need blood. I posted on our internal Facebook, my family and I donated last Friday. So you go through the regular process of the blood donor center. We were in Chatham yesterday. Our blood donor mobile is going out because people are worried to leave their homes. Our blood donation is going down. And these are for patients who need regular blood. This isn't for COVID-19 patients specifically, but the rest of healthcare still continues, and so we do need blood. So please contact the Blood Donor Center. You can go to the SOVAH website, find out where that is. The American Red Cross is not as busy in our community as others, but the American Red Cross is also a source for where you can find information about donating blood.
Great, thank you.
We have nice t-shirts. You can get a free t-shirt.
A question came in about the masks. Alan, you mentioned a lot of people are making their own, and they said that advice is needed for the material of the masks, not just the pattern. Do you have any advice on that, or where could they find that information?
We're going to be, there are a lot of ideas for that, and so we'll be posting something later today on, and we'll get that to the chamber as well so that we can share on all the sites on the material. There's a couple of good patterns, meaning both the pattern and the material, that should be used in order to be most effective.
Great, thank you. Can anyone talk to what would it take for like some type of stay-at-home order to be put in place? Do you anticipate anything like that happening?
That would be the governor's decision if that would ever happen here in Virginia. The local governments are not allowed to make that decision locally. So if it were to happen, it would be ordered by the governor. The fact that it's happened in other locations, indicates that that possibility may exist coming here in Virginia at some point in the future. But right now, we're not, I think, at the level that some of the other states are at for that. But I would not be surprised if that happened. They've put out some guidance on essential services and what that looks like, and I'm sure they would narrow that list down some more, or take a look at that list and provide more guidance on that. But it's really something that people should be looking to the state government to answer that question.
And do you guys have, does City of Danville have text notifications that people can sign up for to stay updated on everything? And the county as well, David?
I think we likely do have text notifications, and I don't have that information in front of me right now. So I will share that with the chamber, and you all can share that out when I get it. Perfect,
thank you. David, do you guys have some type of system similar in the county?
I'm sorry, could you repeat the question? I could not decipher the original question.
You're fine. Do you have some type of text notification system for the county that people can sign up for to stay updated?
Yeah, absolutely. On our main webpage, people can sign up for alerts. But particularly, we also have a reverse 911 system where if we do have targeted information that needs to go out, we're able to contact folks by phone. But we are keeping our Facebook page is our most up-to-date place for county government information, and that's where the majority of information, and if not all the information, will be housed going forward.
Okay, great. We'll be sure to share that link with everyone on the call.
And I'll add to that, you can go to our website and you'll be able to find a Notify Me mass notification system that people can sign up for information. And if you go to our website at any time, right now at the top of our website is a Stay Informed red blinking light that will take you directly to our coronavirus website page.
Great, thank you. Can you all talk a little bit about how a business is designated as essential? Is there a formal process for that?
It's my understanding that the state government comes up with a basic framework, probably working with other state governments to decide becomes an essential business, but it typically would have to do with, are you in the supply chain to provide food to a grocery store? Are you in health care? Are you providing supplies related to the response with regard to masks, et cetera, all the health, the PPE that's necessary. But the governor did put out a little bit of guidance on that. I think it's my understanding, and I believe Matt Rowe with the county took the lead with starting this, is working with our local businesses to reach out to our state to let them know if a business feels like they might be an essential service, that they can get our local economic developers, Matt Rowe and Corey Bobe, to reach out to their state partners and advocate for that, so that they can be included on the list of an essential provider of services during this time.
Great, thank you. One last question that's come through in the chat. How long typically does it take to receive some type of test results?
I'll take a first step of that, and Dr. Spillmann can add if he can hear. It continues to slow down as more tests are being sent. There are only a few testing sites, laboratories that the test can be sent to. The CDC is one through the Virginia Department of Health. There are a couple of private labs, LabCorp and Quest, are also receiving these tests. So some results are taking several days, up to, we have some that are waiting for about a week before we receive test results back. As I mentioned though before, we're assuming these people are positive until we hear otherwise. So we're encouraging them to be quarantined at home. And from my experience so far, they're being very compliant with that and staying quarantined. There are a lot of other people involved in helping to speed up that process, other tests that can be made available, other labs that can be brought online. So that's something we're working on. I'm sure that each of us have heard the press releases from the federal government and monies that are being available to help improve that testing process. Rachel, maybe one other thing, and we sent this earlier to our chamber members, but some of these essential businesses may have question, is it okay to allow my employees come to work? Are they safe? Do they need to be screened and tested? So Alexis sent out something earlier this week to the chamber, maybe just remind people to look for that. What are the screening questions that should be asked by you as an employer? If you have employees that are suspect, please go to the CDC or the chamber website. That information I think is posted there. And you can feel confident that your employees have been appropriately screened to return to work, or if you have suspicion, send them through your regular testing process, screening process, to make sure that they are appropriate for coming to work.
Thank you, Alan. Just so that you all know, Congressman Riggleman will be hosting a teletown hall tomorrow at 2:30. So information on how to participate in that will be posted on his social media accounts on Facebook and Twitter. The time might change depending on his votes, when his votes will take place, but he will be giving an update on COVID-19 and small business. So that's another resource for everyone here. Does anyone who is calling in that does not have access to the chat box have any question for our presenters today?
Rachel, maybe just one thing as we wrap up here. I think it's especially important that we all, as leaders in our community, have a positive attitude and go forward with confidence. A lot of disruption has taken place. My biggest disruption is the lack of any basketball. March Madness has quickly turned into March Sadness. So that's, we're all going through a lot of change. So as we remain optimistic and positive and do our best, there's been a lot of devastation, more, I think, economically than there is actually physically or medically. So these are challenging times, and we would call on all of our chamber members and leadership of our community to rally together, to share, to be confident and be positive. There's a lot of good things happening in our region and in our area. So let's take advantage of the opportunity to look on, find good things that are happening. I'm hearing from people that I haven't heard from before in a long time, wanting to know that I'm okay. So that's a good thing.
All right, we have one more question. Oh, Ken, did you want to say something?
I would just add to that, that as everyone here knows, our area has experienced challenges in the past, and we're a resilient group, I think, here in our region. We've faced challenges before, and we're going to be able to face this challenge and come out the other side and be better for it. You know, it's no secret to anybody in our community that we receive accolades from all over the region, the state, and beyond about the way that we've been able to respond to the challenges we've seen. So I'm very confident in our ability as a community, because of our resilience, to be able to overcome this challenge and come out the other side in a much better place.
We had 2 more questions come through that we still have a couple minutes to take care of. This one is more related towards the banking industry, and I think we have Jeff Haley with American National Bank on the call. So Jeff, if you want to take this one, they're asking what small businesses can be doing right now in regards to the banking industry.
Yeah, thanks, Rachel. I'll give you about 5 bullet points really about the industry. I will tell you, just like Alan's industry, the banking industry is always prepared for these type situations. We are an essential business. So banks are open, they're doing business, doing it just a little different, just like Alan is. There's no need for us to hoard cash. Actually, plastic and electronic payment methods are actually safer. Think about the germs that are on currency. You don't want currency in your pocket. My advice to small business is call your banker before the banker calls you. We already have tools at our disposal to defer principal and interest payments or convert them to interest only. Be very proactive with your banker and call them. They are prepared. They already have the process in place to defer or convert to interest only. We have already begun doing it significantly for our customers. And I would also, I don't know the details, but there might be a good follow-up call, Rachel, for the small business community. As the legislation comes out, the bailout, there is going to be a bucket full, I don't even know if it's what's bigger than a bucket, a ton of money to support small businesses. And there's not going to be a lot of strings attached. I don't have all the details today. I've got some high-level thoughts, but they need to stay in touch with their bankers and be communicating about what's going to be offered from the SBA, the Small Business Administration.
Let me add to that. On our website, discoverdanville.com/COVID-19-response, we are linking to all sorts of resources available for small businesses where they can get access to funds to help continue their business operation or to overcome being closed or whatever when they come out of this.
Great, thank you. And we'll be offering more webinars too with information as things change from day to day. We'll be talking more with the SBA, so we'll certainly be trying to share all the information that we can with our members.
Rachel, so it's probably not all, so the banks are going to be, you've got the SBA Direct that they came out with last week. What I'm talking about, the portal for this money is going to be the banks. It's not going to be the SBA. So basically all banks are going to be authorized to do small business lending based on the product or the relief that's going to be in the bill. So it's really 2 different animals. What they did last week, that is direct with the SBA. What's coming out of the bill is going to be, I believe you're going to see it's going to be direct with the banks.
Okay, thank you, thank you.
Big
Yeah,
difference.
so yeah, absolutely, thank you. We can work together to provide that information to everybody.
This is Dr. Scott Spillman. I apologize again for the technical issues I had today, but just one other thing I wanted to, not about banking, of course, but just want to encourage folks as we get near the end of this time that protective equipment and hand washing and social distancing really should not prevent us from still being supportive and kind to each other. So the virus will pass, despite the fact that many of people will get sick. The virus will pass, and we will be a community even stronger than we are now. And I just want to encourage everyone to be supportive and patient with each other.
Thank you, Dr. Spillman. We can hear you perfectly now, so I'm not sure what changed, but that was great. We have one more question that we'll end the call for. I think, Alan, this is directed towards you. Is the hospital concerned about childcare capacity for its employees if the need for overtime increases?
Yes, we do. I think that is on our preparedness plan. How do we deal with childcare as schools continue to be out and or childcare centers close down? So if anybody has childcare services in the community that they would be willing to make available to our employees, please connect with us. We do have people who are working on childcare resources. At this point, we seem to be okay, but it may become a big issue in the future. So thank you for that question.
Hey, Alan, I don't know what I'm talking about. You know, what about the school teachers? You know, what if you got in serious trouble, could you garner the help of school teachers? Maybe coordinate with Stan Jones, just a thought.
That's a great idea, Jeff. We appreciate those good ideas. Please share.
All right, thank you all. I think that's all the questions we have. Alan, Ken, David, Dr. Spillman, thank you so much for your time and your expertise today. We will send out the link to the recording to everyone who had registered for this event. I know there was a couple glitches today, so thank you for your patience and your flexibility with us. We have another webinar tomorrow at 8 a.m. that's talking about issues for employers amid a pandemic. So you can register for that on our website at dpchamber.org. Hunter Burns and Stephen Gould with Burns Gould Law will be the presenters for that webinar. So that'll be a great source of information for everyone. So again, thank you for your time. We'll be in touch with more information and follow-up information from today's call. Thank you all and have a great week.
Thanks, Rachel.
Thank you.
Thank you very much.